Hey guys, this is Dr. Hub. In case you haven't subscribed, please do subscribe for updates. Now we're going to look at something known as the herd immunity. So what do you mean by herd immunity? So herd immunity is a level of protection in case of a community. So it is very community specific. So it is something to do with the community. Level of protection in a community against a particular disease brought by vaccination or immunization. So it is brought by the vaccine or the immunization. Next is, refers to a group of protection beyond which they are afforded by the protection of immunized individuals. It is difficult to maintain the chain of events of infection in a large portion. So since it is difficult to maintain the chain infection of a large portion of the population, it is immune to certain diseases. So you develop immune to certain diseases. Element which contribute to the immunity, there is occurrence and occurrence of a clinical and subclinical infection in the herd. So the occurrence of the infection or the disease, then you have the immunization of the herd, and then the herd structure. So these are some important terminologies we are going to be discussing. So herd structure not only includes the primary species but also the presence and distribution of the alternate animal host. So it includes the animal host. So alternate animal host is what is included. And there is also presence of the vectors and the environmental social factors. So there is presence of vectors and the environmental social factors, and also the related to the disease spread. And it is not possible or necessary to achieve 100% herd immunity in the population. So you don't need 100%. So you don't need 100% and in a population for the herd immunity. And the portion of the immune individuals above which a disease may no longer spread is called as a herd immunity threshold. So we know what a threshold is beyond which it won't increase. Next is the threshold. It depends on the virulence of the disease and efficacy of the vaccines and contact parameter for the population. So the threshold, it depends on the virulence of the disease. So it depends on the virulence of the disease and then the efficacy of the vaccine. So there's virulence of the disease, there's the efficacy of the vaccine, as well as a contact parameter for the population. The herd immunity is determined by the serological surveys. So this is very important. It is determined by the serological surveys, and the herd immunity does not offer the protection against the disease like tetanus. So one thing that doesn't provide will be the tetanus. To learn and grow daily like this, please do subscribe.